Today our task, we are working now with virtual patient, digestive system disease. Okay, and we are learning gastritis and duodenitis, yeah? Okay, what is mean gastritis disease?
Inflammation stomach and duodenum, and
Okay.
also likewise morphological changes occur in the stomach and duodenum. It like atrophy and rearrangement, and like motor and sensory functions are in the stomach or functions.
Okay, now we are working, and this is our patient, and we have medical history. Now we need taking off complaints and also history. After we are checking patient physical examination. After we are giving advice for laboratory research and instrumental research. After we are putting diagnosis. Okay. Okay, please come one student and tell about for our patient. Come, one student. Okay.
Full name Petrov Andrew.
Petrov
Age
Andrew.
30 years, sex male, growth 163 centimeters, weight 48 kg, BMI 18.1, heart rate 67, respiratory rate 16, blood pressure 110/60, saturation 96, body temperature 36.6.
Okay.
Complaints.
Okay, please ask complaints.
What worries you?
Click.
What worries you?
I have a belch. I have a stomach ache.
What exactly does it hurts?
I have a stomach ache.
Under what condition does the pain arises?
On an empty stomach hurts.
Analysis of the disease. Collection and analysis of disease. When and how did the diseases first manifest? Under what circumstances? For the past few days, discomfort in the stomach was intensified before eating and heartburn after. I
For
still
the past few days, discomfort in the stomach was intensified before eating and heartburn after. I still have an unstable work schedule. There is no regular meal and sleep. Maybe it's about it.
palpitation.
No. Okay, thank you. Complete taking of patient complaints, anamnesis of life. Please come, next student. Okay, this is our student Jennifer. Jennifer, please ask anamnesis of life. You can stand here. Okay.
Analysis of life. Let's collect life history. What did you get sick earlier?
Children's infections about tonsillitis were observed by the ant doctor.
Do you have bad habits, alcohol, smoking?
No, I do not smoke and do not drink.
1 second.
Okay, continue, please.
Are you married? Do you have any children?
No, I'm single.
Tell us what your closest relatives heard.
Father has stomach cancer.
You're working. Tell us about your work.
I am a singer. Harmfulness of the sea, of course. The schedule is irregular. I constantly wander on tour. Eternal squabbles, disassembly on the sidelines, continuous stress.
Do you have any allergy?
Yes. Once there was a quinsing edema on ampicillin.
Are you registered? Do you have chronic diseases?
No, there are no chronic diseases. I do not take medicines.
We are completed anamnesis of life. Which information we are listening now? Which information we are listening now? Please tell. Okay, one student, stand up. What you're listening? Anamnesis of life. What you're listening now?
It does not have any bad habits like alcohol or smoking. The patient is single, and in the family history, the father has a stomach cancer. He does not have any chronic disease. He's not registered with.
Okay.
And he once had a allergic reaction.
Okay. Okay, thank you so much, Jennifer. And the next student, we need take anamnesis. Which? Okay. Okay, palpation. Coming for palpation, next student. Come you. Okay, palpation. Okay, and this place, lie down. Okay, and and patient complains which abdominal area have pain? Which abdomen? Epigastric area, yeah? And this all programs helping for you and giving point where you need palpation. And this epigastric area. Okay, please click. Read.
The area is epigastric, soreness and tension of muscles.
Okay, this is normal pathology.
Pathology.
Yes. Okay, palpation. Okay, thank you. Next, laboratory task. Next student come. Laboratory task. Please click. Okay, open infections marker, open. Okay, read please.
IgG,
Immunoglobulin G.
Immunoglobulin G, Helicobacteria, bacteric pyloric.
Okay, what do you thinking for this patient needs this laboratory task? Yes, because causes of gastritis disease which bacteria? Okay, please click. Good job. Next, general urine analysis. Okay. Okay, click. Okay, and the general blood analysis. Okay, click. Next. And read.
Immunoglobulin G, Helicobacter pylori. Result is positive and reference negative.
And this patient have HP bacteria. Positive. Yes. Yes, have. Okay. Next.
Transparency.
Slightly increasing.
Reference transparent.
Okay. And the ECR?
ECR result is 22 and comment is slightly increased. Reference is 1 to 10 and 2 to 15. Urine and platelets result is 130. Comment slightly reduced. Reference 150 to 400.
Okay. We have, if your platelets decreasing, we assay thrombocytopenia or thrombocytosis. If you decreasing. Thrombocytopenia. Okay. Please familiarize. Thank you so much for our student. Next steps.
Next step is instrumental research.
Okay, instrumental research.
First, ultrasound.
Ultrasound. Okay.
Ultrasound research methods.
Okay.
Ultrasound of the abdomen organ and the retroperitoneal space.
Okay. Need on why? What
we
do
should done because which pain is occurring epigastric region, so we should observe the abdominal organ ultrasound. X-ray of the chest organ. Maybe X-ray is not needed. because pain is in abdomen and chest.
And you know, I think for this patient need X-ray of the chest organs through projection because patient have epigastric area, yeah? And maybe if your patient have if you in the chest organs have any disease, we have nerves, maybe this for nerves irradiating pain, yeah? And we need knowledge, information. Do you have any disease? If you not have, good. Okay, X-ray of the chest to projection, endoscopy.
Endoscopic studies like for fiber endoscope, endoscopic gastroduodenal endoscopy should be done.
Why? What do you think? Why we need this esophageal gastroduodenoscopy?
Because to examine it in abdominal region, where the pain is occurred and how the pain is caused.
No, fibroesophageal gastroduodenoscopy, which organs examining? How we are?
Esophagus and the stomach and intestines.
And the duodenum, yeah. And we need, because HP bacteria, we have positive, and if you have in our stomach bacteria, maybe this bacteria damage or duodenum, stomach, maybe esophagus, we need looking what happened with stomach mucous membrane and duodenum. Okay, good job. Next, histological exam.
Histological examination is like take biopsy of the gastric mucus.
Okay, why we need?
Because we should take a mucous membrane of stomach for biopsy.
Okay, and if we have HP bacteria positive, this bacteria damage stomach mucous membrane. And you know, for classification, I am giving you information in our presentation, PPT, and I am giving classification by histological tissue. And if we are not taking biopsy, how I am putting for histological diagnosis, yeah? Okay, good job. Okay, thank you. Next, ultrasound of the abdominal organs and retroperitoneal space. Sign of the chronic gastritis in the pyloric part of the stomach. The pneumatosis of the large intestine is expressed. Where our pyloric parts of the stomach?
Down part.
Down part.
Lower
yeah?
part.
Okay, we understand. X-ray of the chest organs in true projection, giving information pulmonary files without focal and infiltrative shadows. The roots structural, not expanded, the shadow of the mediastinum without features. The sinuses are free. The boundaries of the heart are within normal limits. Okay. This is pathology or normal?
Normal.
Normal. Not have any disease X-ray. For X-ray of the chest, and we can continue only examining, and we can giving treatment only for digestive system. Yeah? We are not afraid. Maybe this patient have heart disease, yeah? Maybe this patient dying in the home, because we are checking and we assay in your in the chest organ not have any pathological situation. Okay, fibro you need to understand fibro esophago gastro
Duodenoscopy.
Giving gastroesophageal reflux. Patient have gastroesophageal reflux. What is mean gastroesophageal reflux? We have esophagus and stomach. Between we have sphincter. And if this sphincter not good construction and the opening, or stomach acids jumping where? Esophagus. And in the stomach acid higher, and this acid damage or esophagus mucosa. More times this patient say, I have burning, I'm feeling and not good acid in my mouth. I can't sleeping lie down because starting burning and pain in gastric areas for this disease. Cardia insufficiency. Cardia, which part?
Uppermost part.
Huh?
Uppermost part.
Upper, yeah. And near sphincter, this area
Body.
we assess,
Body.
yeah, cardial region. This cardial region insufficiency. This means he is not used his function. Destructive ulcer on an erotic surface of the pylori department against the background of the hyperemia. What have ulcer?
Ulcer in pylori.
Taking biopsy of the gastric mucosa, the histological structure of the gastric mucosa is inflammatory, infiltration, spiral bacteria, and detected during painting. Okay, diagnosis. And the stomach ulcer is acute without bleeding or perforation. This is true diagnosis. And fibrogastroendoscopy, giving information for bleeding. No. Okay. And also giving information for perforation. No. And giving only half ulcer. Yeah, this is true. And you know K 25.3. What is mean? ICD 10 classification disease. Okay, treatment recommendation: diet therapy, prednisolone, tetracycline because have bacteria. This is antibiotics: calcicarbonate, omeprazole, amoxicillin, and clarithromycin. You know, if we have ulcer and our treatment complex, because HP bacteria very powerful and very dangerous. If we are giving only one antibiotics, these antibiotics not killing this bacteria. And we need complex therapy. Complex therapy, we are telling if we are giving more than 2 antibiotics, we are say complex antibiotic therapy. And we have tetracycline, amoxicillin antibiotics, and clarithromycin. Amoxicillin, we are giving 1000 mg in 1 day. Clarithromycin, we are giving 500 mg 1 day. Normally, if we have ulcer and our treatment 14 days. And normally, I am giving 14 days. If this patient not have any chronic kidney and liver disease, I am giving 14 days. And also, we are giving omeprazole, antacids in combination with other drugs. Antacids, this is decreasing our acids because HP not, if you decreasing acids, HP not liking this. And after this bacteria dying, after completed our therapy 14 days, and we assay patient again coming, we checking again fibro, esophageal, gastro-duodenoscopy. You understand why? Because we need checking patient's stomach mucous membrane, helping for this treatment or not. Yeah? Okay. No, I'm telling.
Congratulations, you did very well. I recommend that you go through the next scenario on this topic. To do this, you can click on the Open New Scenario button. You can view a detailed report of the scenario by clicking on the button to open the detailed report.
Okay, ma'am, thank you. And thank you for our growth. Good job. And you know, more time our fibroesophageal gastro-duodenoscopy, this is painful. More patients not like it. And we have now new instrumental research methods, capsule endoscopy. We are listed in capsule endoscopy. Capsule endoscopy, this is very expensive, but if you're working in private clinic and if your hospital, maybe your country very rich and in all hospitals have capsule endoscopy, and you can make this. But now only in our Kazakhstan and we have big clinics maybe, or private clinics have capsule endoscopy. This is not painful, and giving small this capsule, or a patient coming for diet, not eating, because we need cleaning our digestive system organs. Patient drinking this capsule have camera and light, and this capsule examining all our digestive system, and our programs writing. Patient drinking this capsule, making video photo or esophagus, stomach, duodenum, jejunum, and the colon, and the descending transfers, and the sigmoid and rectum. And this is very expensive and bad, very good information. I think maybe 10 years, maybe 20, 30 years, maybe this type of examination maybe have in every village. Yeah, if you, and for this important for our government and for our economics country. Yeah, and but you know, in our Kazakhstan in private clinic, this capsule methods endoscopy 150,000 tenge one time. But very good, not painful, good information, and also you know, and also giving information for jejunum and also for our colon, because colonoscopy and ileoscopy very painful. We need entering in between this rectum and this is very painful. I think if your patient say I not like pain, I don't want this exam, and say I have money, do you have any other methods not painful, and you can giving advice, capsule endoscopy methods. Okay, gastritis, duodenitis, and ulcer, we are understanding.
Yes, ma'am.
Okay, thank you so much. Так.